Welcome to Dental Success Beyond Chairside, the podcast that is dedicated to revolutionising the way dental professionals succeed beyond the dental chair. Join us for a unique blend of insightful interviews with industry experts and valuable tidbits of information to help you thrive in your dental specialist practice. In each 20-minute episode, we'll delve into a variety of topics, including HR, marketing, innovative techniques and systems, and AI, to help you transform your practice and unlock its full potential. Whether you're a dentist, specialist, or oral health therapist looking to enhance your practice, this podcast is your go-to resource for professional, personal, and profitable success. Get ready to go beyond the dental chair and discover what lies ahead in your practice journey with Dental Success Beyond Chairside. Are you spending money on attracting new patients while overlooking the ones already in your system? In today's episode, we focus on recall, one of the most overlooked yet powerful systems in driving sustainable growth. Joining me is Nosh Hands from Re-Engagement Consultants, a team with over 50 years' experience supporting practices to clean their data, re-engage patients, and strengthen recall systems that drive consistent bookings. We'll explore what's really happening when patients are contacted, where communication breaks down, and what your team can do to close that gap. Nosh, thank you so much for joining us today.
Thanks for having me.
We're really looking forward to what you've got to share. And speaking of sharing, can you share your story and tell us what you are hearing from patients during the re-engagement process and how important is language and consistency in how those conversations are handled?
Yeah, absolutely. I've been in the dental industry for many decades, and what I've come to see in working with lots of different practices is that there is a gap between patients' re-engagement piece in a practice. What I'm talking about is their recall system is either relied upon with text messages going out from their practice software system or emails going out, and the buy-in from patients for that is very, very low. So what my team at Re-Engagement Consultants do is we reach out to patients, a human touch, to try to get them back into the appointment book. But through doing this journey, I've discovered that it's a bigger piece than just getting patients back and just calling a patient up on a phone. It starts off when the dentist actually finishes his treatment in the treatment room, has that conversation with that patient, whether or not they need extensive treatment or just their 6-monthly checkup. Their 6-monthly checkup is as important as if you have needing treatment. So that conversation and the language used, making patients informed about the importance of coming back into a practice and making patients be aware that they need to come in and have it as a priority in their life. So it's that conversation on how and the language that is used in the surgery to begin with, and that walking of the patients to the front desk where your support staff are there to finish off and close that whole journey off. And meaning is that a patient shouldn't really walk out without a 6-monthly appointment, or whether they're walking out with being really informed that the practice is going to be contacting them at a particular time when they're due to come back in, and making their agreement that yes, that's okay to contact them. When we as a team call that patient, the buy-in is a lot greater because that their expectation is already set from the practice. Unfortunately, with a lot of busy dental practices, the reliance on the 6-monthly text messages and emails goes, so it's not really touched base on too much unless they've got a gap in the book and they've got a few minutes spare to pick up the phone and call, or if they've set aside a few minutes to do some recalls. That whole process isn't done well enough because they can't get through the amount of patients that need to be contacted. It's about getting your processes really fine-tuned so it makes it easier for front desk. And also what we tend to do is we get it to that level, we hand it back, we do some training with the practice itself from start to finish in order to tighten up that gap that we're seeing at, in the dental practice, really.
Yes, absolutely. It really is communication in the actual clinic, because I think recall often is relied upon with the front desk. So it's just like, go to the front desk and book the 12 months. But that conversation hasn't been had with the patient about how important it is over the last decade, 15 years. It's always like, make sure you look at your recalls to make sure you're getting an appointment booked straight away, which is great. So the recall looks really good. So you might have 75% of people rebooking in, but at the other end they ring and they go, oh, no, we're cancelling. Oh, would you like to reschedule? No. But it's because they haven't got that understanding. So it's not the front desk, it's in the clinic. What sort of communication breakdowns do you see that you're seeing in the clinic between the practitioner and patients, Nosh?
There's a lot. So a lot of times there is a time restraint.
There's a what,
there's,
sorry?
there's a time restraint. So there's a patient waiting, and that dentist needs to get to that next patient. So they wrap it up really quickly. Okay, we'll see you next time. And that's it. And there's also a breakdown between the dentist and whoever's checking that patient out. So if the dentist walks the patient out and says to the front desk, Mrs. Smith needs to come back in. I'm really concerned that she needs to come back in within this time. You don't need to go into details at the front desk because there's other patients in the waiting room. We don't need to, air everyone's laundry out. But I think that the choice of words is really important, and letting the patient know that the dentist really cares, that they really need to see them back in. So it's that communication with the dentist and front of house. And also I think it's important for the dentist to have the patient listen to that as well, not just pick up the phone and from the surgery to the front desk and say, can you get Mrs. Smith in. It's basically they need to hear how the dentist feels about them having their next appointment, and it's showing that patient out. So there's a communication between the dentist and the front of house staff, and there's a communication that needs to happen with the actual patient, which is, I think, is really vital to get that buy-in to making that next appointment. I suppose I'm very lucky with the team that I've got in at the moment, because we're all dentally trained. When we do call for that recall, it's not a robotic, oh, you're due for your 6-monthly checkup. We spend time looking at that patient's file, knowing that there's a touch point if perhaps they have decay on the tooth, or a tooth that the dentist was a bit concerned about. These are the touch points that we look for in their dental notes. And when we call, we say to the patient, Mrs. Smith, your tooth up at the top, your doctor, whoever, was really concerned about that tooth. He really liked to see you come back in. When can I book you in? Not, do you have time? And not giving them a question about whether or not they can or can't. Yeah. It's language that is used to bring that patient back in. And more likely or not, there is a chance that the patient will book in and cancel again, but we've given a real hot shot about getting that patient back in. I think that the language is really important, and understanding the dental notes, which again becomes communication, making sure that the dentist themselves are putting good notes in there at a timely manner. So everyone's across what is that patient's journey moving out, leaving the practice.
Yeah. And I think with time restraint, it's really easy to build up parameters of like a 5-question summary or a 5-question, then repeating that outcome, what's going to happen, blah, 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 blah. As you said, that one-to-one handover to explain it, because then the patient feels really heard when they can hear that the doctor is handing over to the front desk. It's just like, yes, that's correct. Yes, that's what we talked about. Yes, I understand that. We were talking to a treatment coordinator for orthodontics, and she was talking about micro yeses. And it's all these yeses that create that trust, because at the end of the day, you're trying to do the best for the patient, but they have to understand why it's good for them as well. But what the outcome possibly is if we don't keep on monitoring it. We've been touching a lot on recalls. Nosh, can we talk more about if treatment is recommended? So higher investments treatment.
Yeah, absolutely.
What do you find there?
It depends on how the dentist has placed it, and you get a gather. Each practice is completely different, and how they work and how they function. So our team gets a real understanding about how that practice works before we pick up that first phone call. So we have to understand the practice first. We have to understand the wordings used, because when you're talking about high treatment that needs to come in, value treatment, some people, especially dentists find it quite confronting talking about monetary, especially if it's at the higher end. I think for us, it's just alluding them back to the practice. The dentist is in a comfortable environment to reinforce that if they haven't made that appointment. If it's something that is cosmetic, I think that's a nice way of doing it gently, just to get them back in so the dentist can take over from there. If it's something that is not only cosmetic but functional as well, but it's high value treatment, this is something that we read through the notes, and when we show the concern about what the dentist was concerned about, whether that was a drifting tooth or whether that closing a gap, how important that is, whether it's a denture or implants, whatever that scenario might be, and we touch on those points, the patient hears it from a few different people, and they say, okay, well, I've been hearing the same messaging, I've left it for a year or so. If the patient still doesn't want to come back because whatever reasons, a lot of the times financial reasons, those are the times that we come down with a softer approach and say, okay, I understand you don't want to come in for those particular treatments, but you are due for a 6-month checkup, and we don't want to get you into a position where the value of your treatment becomes higher because we haven't sorted out anything that may have happened in the last year or so. So it's going for those high treatment plans, hoping to get them in. But if we have that negative response back, then we go down to the softer approach. At least if we get them back in for their checkups, then the dentist can take it from there. And it's all about that conversation piece that the dentist has to get their buy-in from that patient.
So really, Nosh, I mean, what you're seeing in real life when you've been working in dentistry, how you identified that gap, is it's all about open two-way conversation, understanding, not making guesses about what's actually going on, asking questions to sort of get exactly what their objections or their concerns might be. I know you did talk about financial, but I think when I've seen it, when I was in a manager, people would just go, oh no, it's just too expensive. But I don't think it's necessarily financial. They just don't understand necessarily the value of what it's actually bringing them. I think the importance there is in open questions, understanding, building trust. What are your thoughts around that, Nosh?
I think it's really important to build trust. A bigger piece when you're treating a patient. It's not just about, one, you can't prejudge what a patient needs financially. You need to give them an informed package when you're talking to a practice. So it's with a patient. So if I'm going for high value treatment, that the patient needs X, Y, and Z, and it's high value, there's different options. The dentist needs to give that patient all the options out there available and let them make an informed decision. But it's really important, what is left behind is that these patients are not followed up. What I'm finding in practice, they're not followed. They've been given the choices. There's treatment plans on their practice software, and there's multiple different treatment plans for the same thing. But when no one calls them in a week or 2 weeks to say, you know what, you've been here a couple of weeks, we've given you some time to think about it. Where are you at with this? And have that open conversation for them to revisit it, not just left for another year, because in another year there's all sorts of other things happening as you in the mouth. So it's really important to touch base with the patient in a timely manner, which is completely missed in practices. So
Absolutely.
whether it's for a checkup and clean or for treatment, what I've been finding, there's lots of patients out there that are in the middle of an RCT or root treatment, and they've just been left in the middle, that they haven't been contacted back. I suppose it comes down to a process as well, because front of desk is really busy because they're checking patients in and out, and it depends on how many dentists, clinicians you've got working in a practice. It gets really busy, and the dentist feels busy because he's got a full book. And so it's about finding that time to treat the patients as gold standard. And gold standard is that you diagnose, you make a suggestion. If they don't come back, follow that up. You might be able to help that patient in a way, okay, you don't want the high value treatment, but these are the other options we're giving. Would you consider these options? And then that might be a light bulb moment for a patient to say, okay, maybe for now, let's go for this option. I won't go for the best of the best, but for the meantime, I can go for this option. I think it's about that communication piece again and finding the right process in a practice that these patients are just not left behind.
Mm.
And that's what I'm
Exactly.
finding.
And as we've seen, is that recall follow-up just falls to the bottom of the pile because everyone's too busy, and they feel like they're asking, they're being salesy, they're doing this, and that's too hard. I don't want to do that. Oh, we've got other things we've got to do. So it falls to the bottom of the pile. I really advocate like a patient liaison coordinator or someone in the practice to be able to have those conversations with patients. Orthodontic practices, most of them have got it down pat with treatment coordinators who do that, who have the follow-up. But having someone in the practice that you designate, when you look at a return of increasing your conversion rates, particularly on high-end treatments where most of your profit is coming from, and what you're going to pay someone to do it, you're going to get return on investment hugely.
Yeah, absolutely.
Yeah,
Absolutely.
that's like having re-engaged consultants. You're actually doing that to get it. But obviously the communication piece is huge. So Nosh, we've covered a lot. Is there anything that you'd like to share with our listeners that we haven't covered?
Yes. So I think what we haven't covered is the data cleanup that we
Oh,
do.
yes.
While doing the recall system, my team and I, we do the data cleanup. So, which means that we go through their recall system methodically. Any patients that are no longer a part of the practice or they've moved or for whatever reason, we make them inactive on the system. We also highlight any bad debts that are out there. And believe me, I've found a lot in a practice that haven't been attended to. Yes, thousands of dollars that are not attended to. And so sometimes it's just an error on the system that they haven't allocated it properly, but a lot of the time they're just bad debts that are just sitting there. So we highlight that to the practice, and on a weekly basis, we give them a rundown of what's happening in the practice, the patients that need to be followed up by the practice, which we can't do for instance, a patient's waiting for a treatment plan to be handed to them, or they're waiting for a dentist to get back. So we highlight that for them, and on a weekly basis, we give them that spreadsheet, and it tells exactly what's happening in the practice. But I think that data cleanup is so important and essential for a practice for a lot of reasons. If they want to do marketing, they're going out to a clean database to patients that really want to be a part of the practice still. I think that's a really important piece. So I suppose that's the thing that I wanted to touch on as well.
Absolutely. No, that is very important. And I mean, I see that a lot, especially so many active patients without recalls or without an appointment, and they've just been there for years. It's just archives.
Yeah, absolutely. I mean, you've got a sweet spot. I find that you've got a sweet spot with patients, and that's about a 2-year sweet spot. And a lot of patients will stay longer than that, but that is the sweet spot. So you need to get their treatment done within that period of time, I think.
Excellent. Well, Nosh, thank you so much for joining us today. We really appreciate your time. For more information about Nosh and re-engagement consultants, please see our show notes. Thank you so much, Nosh. Really appreciate having you on. And yeah, have a great week. Bye.
Thank you. Thanks for having me. Bye.
In our next episode, we'll be exploring a different side of communication in practice, one that reaches beyond systems and workflows and into leadership, relationships, and the personal side of practice ownership. I'll be joined by Dr. Parul Bhatia, a UK-trained dentist based in Perth and the founder of Butler Dental. With more than 20 years in dentistry, Parul has led with compassion, supported anxious patients and new graduates, and understands the weight that leadership can carry. We'll be talking about her journey through practice ownership, burnout, and transition, and what those experiences taught her about communication, team dynamics, and leading with authenticity. Thanks for listening to Dental Success Beyond Chairside. See you next time.